My name is Dr. Steve Wunderlich. I'm a Vice President for Research in Sanford. This is my Blue Chair story. Fargo-Moorhead was my home. It was a great place to simply grow up. It was a good experience for me being up here and drew me back. I started here in 1987. And I started at the University of North Dakota, but they had a deal where half my time I had to work in a clinical setting. So I've been working one way or another in Sanford for, is that 37 years? That's a long time. When I first came here, we were trying to get an eating disorder treatment program off the ground. And a bunch of us worked on that. And, we got it going. At the same time, we were doing research on eating disorder patients that we were seeing. And it was great because we were able to do science, but also it was feeding back in and helping us kind of hone our treatments. Some of the eating disorders were pretty unknown to the professional community. But one of the things that happened rather quickly was when we started treating a lot of people with eating disorders, especially the kids, the teenage kids, we had a need to have hospital care, and we didn't have it. We didn't have it anywhere in this region. And then we started to have to refer the kids out. And it was hundreds of miles, thousands of miles in some instances. And you send a teenage kid and usually one of their parents to Arizona, Philadelphia, or Florida for care, and you could see what it did, not just to the kid, but to the family. You take a teenage child and you send them across the country with a life-threatening illness, and another parent or a grandparent trying to take care of all that. And so it's terribly stressful. I just remember a number of situations where there were farm families who had a child who needed care. And the complexity of that, because one or both of the parents needed to be on the farm, needed to be in the field. And you see how it reverberates through families. So we could send them off to a good program, and they would get better, but they needed outpatient care. So then they come back 2,000 miles, and we get a discharge note, and maybe we get a phone call. But we haven't been with them for the last 2 to 3 months. And so just the continuity of care was a problem. Pretty soon we knew we have to have that here. And then we were able to launch the inpatient and day hospital program, which just made a tremendous difference. Kids from this region and all over the region. And if they need to go in the hospital, we can do it here. When they leave our hospital, they can go to our outpatient clinic. They can step down from inpatient to day hospital to outpatient, and we provide them real comprehensive care, and it works. Treating eating disorder patients, including teenagers, is complicated work. Eating disorders, especially anorexia nervosa, are very serious, potentially lethal disorders. You're thinking about a multitude of things when you're treating these kids, and you have to have medical providers, dietary providers, mental health providers, all really working together to create a team that holds this kid and takes care of this kid. We need skills from multiple disciplines working really tightly together so that the illness doesn't sort of run its course. We got to somehow stop it or divert it. We've been able to develop some treatments based on the science, which we then test in scientific studies to see if the treatments work, and they do. And we're now training people on how to do them, not just here, but around the United States and in fact around the world. Not only do we take care of our own folks, we're trying to figure out how to take care of everybody. The idea is to create something that not only is helpful now, but it's going to be helpful for a long, long time. And when I do think back, I've got a handful of kids in my mind who, in one way or another, I've heard from or I run into or something. And, they're well and they've got their own families and they're moving on with life. That's kind of the piece that drives home the point that we need to do all this. We can't just do a piece of it. We gotta provide all the care. And Merit Care at the time, Sanford now, just embraces that, and that's been a great thing. First of all, I get to work on an important topic that matters, and so hopefully it helps out people. And I get to work with these teams. Look, if any of my teammates were here and you asked them, what can Wonderlic do by himself? They'd probably say not a lot, but he's a good teammate. And so I get to work with good people. We get to do things about meaningful topics. I don't know, it doesn't get much better than that.